So you think your pet may have had a seizure. That's pretty terrifying. Let's talk about it. Hello everyone, Dr. Rhett here, and today we're going to be discussing sudden loss of consciousness in your pet. Most of the time when this happens, people tend to think that it's seizure activity, but it isn't always the case. So let's say it's just a normal day in your house, nothing exciting going on, and suddenly, out of nowhere, your pet suddenly loses consciousness, drops to the ground. In a panic, you scoop them up, throw them in your car, go straight to your veterinarian, and tell them you think your pet just had a seizure. Most likely, the first thing that your veterinarian is going to do is try to figure out if it really was seizure activity or something called syncope. Seizures and syncope can look a lot alike. However, the causes are very different, and it's important that we try to figure out which one it is because they have very different diagnostic procedures and treatments. So what exactly is the difference between seizures and syncope? Seizures have a neurologic cause, meaning they involve the brain. Syncope, on the other hand, is due to cardiologic causes, meaning that it involves the heart. In order to try and determine whether your pet's loss of consciousness is caused by seizures or syncope, we're going to ask you some very specific questions. We're most likely going to start by asking you if there's any chance that your pet could have gotten into anything toxic, either in or around the house. If you're absolutely certain that your pet has no access to anything toxic, then we may ask you certain questions such as, did your pet act differently before the episode? Also, what exactly happened during the episode itself? Did they just fall over? Did they convulse? Did they vomit? Did they urinate or defecate? Also, how did your pet act after it regained consciousness? Did they just hop back up like nothing was ever wrong? Or did they act mentally dull for a while? Did they stumble around, bump into things? Once we've gathered as much information from you about the actual episode as we can, we're going to hopefully have a better idea as to whether it was actually a seizure or a syncopal episode. The reason why we ask those specific questions is because although seizures and syncope can look a lot alike, they do have a few very specific things that separate them. For instance, seizures have 3 distinct phases. The first phase is something called the pre-ictal phase. During this phase, your pet may act differently. Sometimes they go off on their own and hide. Sometimes they become very anxious or nervous, or they may not leave your side. Other times, however, if you're not specifically looking for any strange behavioral changes, they can be so subtle that you may not actually notice anything wrong. The second phase is called ictus. This is when the actual seizure occurs. Now, seizures don't always look like what you see in the movies or on TV. They don't always look like violent convulsions. Sometimes they can be as subtle as just a very mild shaking or biting at the air. Sometimes they may get really stiff and fall over, but they don't necessarily go into the wild, violent convulsions. And then, of course, they can have what we call grand mal seizure activity, in which they do convulse. Just before the actual seizure or during the seizure, they may vomit or urinate and defecate on themselves. The actual seizure activity usually lasts for a couple of minutes. But if they're having something called cluster seizures, it can last for way longer than that. The third phase is something that we call the post-ictal phase. During this phase, they regain consciousness, but they seem to be mentally dull. Almost like the lights are on, but nobody's home. They can seem really out of it. They can stumble around. Sometimes they can actually bump into things because they can be temporarily blind for a short period of time. This post-ictal phase can last anywhere from minutes to hours. In the case of syncope, your pet still loses consciousness and may fall over. They may also vomit and urinate and defecate on themselves, but one of the biggest differences between syncope and seizures is that once your pet regains consciousness, they tend to pick up right where they left off before they passed out like nothing was ever wrong. If they do seem mentally dull, it's only usually for a few seconds to maybe a minute or two. After that, they seem perfectly normal. These are sort of the textbook presentations of how seizures and syncope appear. However, they can be really difficult to determine which is which sometimes. In both cases, they may vomit. In both cases, they may urinate or defecate on themselves. They don't always convulse when they have seizures, but they can sometimes look like they're convulsing whenever they have a syncopal episode. In the case of seizure activity, the patient loses consciousness for a period of time because basically something short circuits the brain. However, in syncope, the patient loses loses consciousness because something disrupts the flow of blood to the brain. That's usually caused by something wrong with the heart. Both seizure activity and syncope can have a couple of common causes, so it's likely that we'll start looking for those first. And those usually include things like toxic causes, so we may ask you if there's any chance that your pet could have gotten into anything potentially toxic either in or around the house. And then infectious causes, in which case we'll run some specific tests to try to rule that out as well. If we can rule out those common causes, then we start looking for more specific causes. In the case of seizure activity, if your pet is very young, then we're going to start looking for congenital causes, which means that we're going to start looking for things that your pet may have been born with. If your pet is a young adult or an adult, then we start looking to rule out something called idiopathic epilepsy. And if your pet is older or geriatric, then we start looking for things like cancer or something called GME. Now, even though we may prioritize those specific tests based on the age of your pet, that doesn't mean that they can't overlap. A young adult may actually have a cancer, or a senior pet may have been born with a congenital abnormality that's only now causing a problem. Or all three of those life stages may be affected by some other problem like a severe liver issue. So you can see it can sometimes be a pretty long road before you actually find an answer, and you may never find an exact answer, but you can rule a lot of things out. In the case of syncope, a lot of those diagnostic tests will also be relevant. However, we're also going to specifically be looking for cardiac causes. Particularly, we're going to be looking for arrhythmias of the heart, which means that we may run something called an EKG. However, even if the EKG that we do right then and there looks normal, that doesn't mean that your pet doesn't have an arrhythmia. It just means that your pet didn't have an arrhythmia at the time that we ran the EKG. So even if things do look normal, but we still suspect that it was a syncopal episode, we may discuss further diagnostics with you, such as seeing a board-certified cardiologist so they can perform an echocardiogram, or getting your pet to wear something called a Holter monitor. A Holter monitor is basically a vest that monitors your pet's heart rhythm for at least 24 hours. After that period of time, we take that vest back and send it to a cardiologist so they can analyze the EKG. And they may actually find that your pet is having an intermittent arrhythmia that comes and goes. The best thing that you can do if you find yourself in a situation in which your pet loses consciousness is pay very close attention to what's happening during the episode and after the episode, so that when you speak with your veterinarian, you can accurately tell them what happened. Another very helpful thing you can do is write down what's happening when it happens. That way, when your brain goes into panic mode, you don't forget the very important little details. And lastly, you actually have one of the best possible diagnostic tools at your disposal at home right now. I'm talking about this little thing right here. Just about everybody has a smartphone, and just about everybody has that smartphone either in their hand at all times or within close reach. If you have the presence of mind and you're fast enough to pull that phone out and start videoing what's happening, that's the best possible early diagnostic tool that we can use as doctors, because we can see with our own eyes exactly what's happening. Make sure not to just video the episode itself, but also take some time to video what's happening with your pet as they're waking up. Now, this of course is already assuming that you didn't just scoop your pet up, throw it in the car, and race over to the veterinarian's office. A couple of extra little pointers here as well. When your pet is having this episode, don't try to reach into its mouth. There is a myth out there that says that whenever people or animals have a seizure, that they're at risk of swallowing their tongue. This is actually physically impossible, and if you go shoving your hand in their mouth, you could get bit. They won't know that they're biting you, but they may lock down on your hand and not have the ability to let go. If they are violently thrashing around, you can try to very carefully support their head so that they don't bang it on the ground. Just make sure to keep your hand away from their mouth. So I only brushed the surface of these two very complicated topics. The goal of this video was basically to give you some guidance on what to do if your pet loses consciousness, as well as some tips on what to pay attention to so that your veterinarian has a better chance of diagnosing what was wrong with your pet. I'll probably make a couple of videos in the future so that I can delve a little deeper into things like seizures and cardiac issues. But until then, if you like this video, please don't forget to like, subscribe, and share, and I'll see you next time.